The Sisters of St. Joseph of Toronto, throughout their history in Canada from 1851, have been involved in work to respond to the needs of the dear neighbour, especially those who are experiencing economic hardship and those living in situations which put them at risk. Our response over the years has been to provide leadership and support in healthcare, education, and social services. Today, we will hear from 5 of our sisters, each with a wealth of experience working with people who are challenged in various ways by our social systems. Each sister has been asked to tell us a story about her experience. We hope that these stories will touch your hearts and help the government to bring about real, lasting change for those living in poverty.
I lived with people with disabilities at Neighbour, north of Toronto, in that community for 40 years. And I listened to numbers of parents who face enormous challenges every day. So I'm so thankful for this poverty reduction strategy on behalf of Canadians in need. My friends, a family whose real names I'm not using today, live outside the city for financial reasons. Joe is the loving father who works 4 12-hour shifts, has 4 days off, and then 4 12-hour night shifts. He receives a modest income. Marjorie, his caring wife, is a stay-at-home mom. Their eldest son, John, is very bright and an athletic teenager, and their younger sons, Jim, 12, and Mike, 9, are lively boys who have each been diagnosed with the missing X chromosome. Jim and Mike suffer severe cognitive impairment, extensive seizure activity, especially during the night, spike waves in sleep, and unending attention disorders. Jim has no speech, and Mike's speech has recently gone, so he is increasingly lost in blank stares, hand movements, and squealing noises. Life is never simple for this family, but it's easiest when there's routine, best provided by special education classes in school, attended by both the boys. But this routine is frequently interrupted due to exhaustion from night seizuring and from recurring day-long excursions to Sick Children's Hospital for urgent medical care. Both boys are in diapers, able to walk and eat on their own, but they need constant supervision. If they are left alone, they run outside or disappear in the home, or undo and make a mess with a dirty diaper. This year alone, they have destroyed 3 television sets before the installation of a sturdy plastic enclosure. Now that the boys are bigger and stronger, their grandparents fear to care for them alone, so their parents are the sole caregivers 24/7 during all the summer holidays, school breaks, and all the times apart from school hours. Marjorie and Joe are exhausted, and some of the things they say are, how do we possibly keep going? Who can help us get the services we need? Who will love our children and provide a place of belonging and safety for them in the future? How do we even access services and get on a waiting list? What about our eldest son, John, who has no one-on-one time with either of us, especially since he came home not long ago to find his mother in tears, rocking and banging her head in utter despair. He was frightened and wanted to call an ambulance because he worries for them and they worry for him. And everyone worries for the day that one of the parents will lose it or become ill. So I very much personally want to thank you for this present consultation by the government and your efforts on our behalf and on the behalf of so many friends that I have and others in Canada. Perhaps with your colleagues you will act to offer urgent, needed hands-on support for families in these precarious situations. Two desperate unmet needs today are: one, the support of an advocate who finds and connects parents with complicated government, educational, medical, financial, and essential services. What a gift that would be. Second, the need for parent respite and personal time during weekends and school breaks, and especially in the summer, with one parent working full-time outside the household. Finally, I'd like to offer one creative consideration, because costly poverty reduction strategies can be very telling. Our caring for our less fortunate citizens is not simply, though, about money, but about the kind of society that we're trying to create together. Perhaps strategists could step back and consider a larger perspective, that of broadening our higher educational system to utilize the gifts of our young academics and in support of their less fortunate sisters and brother Canadians. Shouldn't our education system include educating young Canadian scholars in human relationships and matters of the heart? Wouldn't it be good for them to give hands-on care for those who need care? Isn't it time to allow them the opportunity and the occasion to experience welcome and gratitude, joy and honesty and unconditional love, the gifts of people with disabilities, while revealing to them their amazing gifts of competency and care? Isn't this a good preparation for young people's future? With such an innovation and creativity, everyone profits and everyone's life is enhanced. So my sincere thanks to each of you for this opportunity to engage our creativity in support of Joe and Marjorie and their precious children. And we all anxiously await your caring action on their behalf.
My name is Sister Divina Pedro. I live and work in Fort St. James, BC, a community consisting of mostly the Carrier people. When we think of poverty among our First Nations people, for most of us, the first thing that would come to our minds is their addiction to drugs and alcohol, abuse, overdose, violence, suicides. These are true, but I believe that they are results of deeper realities. Mother Teresa spoke of poverty as not being limited to hunger, nakedness, and homelessness. She said that the greatest poverty is that of that feeling unloved, uncared for, unwanted. And that is where our First Nations people are. And aside from that, they feel that their culture meant nothing to many people. So the two deeper realities that I think of is that they carry the pain of the past, and now they carry the burden of the present. The report of the Truth and Reconciliation has been out, but I think there's still more work to be done in terms of healing and reconciliation. I will cite two examples. A man I spoke to said to me, "I've been drinking since I was 12 years old, sister. What can we do? I'm an alcoholic, a child of alcoholics. I'm hopeless, I'm nothing, I'm garbage." No amount of encouragement would change his mind about himself. Then I invited him for prayers of the Stations of the Cross in Carrier. He was so delighted. He said to me, "I don't even know my language, sister." And then he said, "Thank you for inviting me, for welcoming me. I haven't been welcomed for so many, many years." Another example is a woman who I journeyed with for about 5 years. He said to me on the street, "Sister, you have done everything for me. You cared for me, you loved me. So just give me a hug." That happened many times. 2 months ago, she said to me, "Sister, I should have listened to you. Now it's too late. She died a month ago. Both parents attended residential school. Both of them tried to numb their pain through alcohol and drugs. What is being done? The returning to spirit has helped many of our people here. It's a reconciliation program between First Nations and non-Aboriginal. One woman said to me, because of the returning to spirit, I am who I am now. There's still some pain that she could recall, but she's a better person. We have a local food bank, a local soup kitchen, and a drop-in. These are places where they are welcomed and treated with respect. Another deeper reality is the logging and the mining. On a 45-minute drive to Tache, one of the reserves, I would normally see logging trucks, about 45 to 50 of them. And I was told about 500 go out of our land here. Wood is processed outside. And because of the logging down by the river, it left nothing for the animals, protection for the animals, habitat for the animals, shade for the spawning fish, plants to grow. So it deprives them of their own culture, of their own food, and it destroys the land. An open pit mine that opened here about 5 years ago has destroyed the land, the streams and the rivers that they live on, that has been passed on from generation to generation. A group of people go up to the mine every year for a ceremony to honor the land, to pray to the four corners for the land, for the people, for the animals, for the medicine plants, and for the people who work there. Our carrier people do not say goodbye. They would say Nanyu Stenla until we see each other again. And that is what they say to the land. Nanyu Stenla until we see you again. 20 years down the road, the mine will be closed. Our people will still be here. And at that time, they will reclaim the land, nurture the land, love the land, and hopefully new life will happen. Our First Nations people are suffering. They need our help. Let us wake up and open our eyes and address and answer and respond to their needs. Thank you.
The Food and Agricultural Organization of the UN says food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food which meets their dietary needs and food preferences for an active and healthy life. Stats Canada says, recognized as a public health issue in Canada, household food insecurity has been associated with a range of poor physical and mental health outcomes, such as multiple chronic conditions, distress, and depressions. At Mustard Seed, where I minister, we welcome all, but give priority to those who might not have opportunities to nurture body, mind, and spirit. Now, food plays a big part, of course, in that nurturing. But we try not to have it doing for. We try to involve the participants and call forth their gifts. And every day we see food insecurity. Of course, names are changed. For instance, Mabel hobbles in. She's on ODSP, pays rent, cooks. but she just lost her hearing aids and hasn't enough to replace them. And when she pays what she must pay, she's going to have to choose. Is that hearing or food? Sister Rosemary gives free foot care here and sees horrific calluses and corn, she tells me. Second-hand shoes and not enough money for car fare means walking distances to various free meals for those living in poverty. The food bank helps Sally, Ted, and Carl, but non-perishable donations don't provide enough protein, vitamins, and Sally's pre-diabetic, Ted is glucose intolerant, and Carl is allergic to certain foods. Now, 4 not-for-profit agencies in South Riverdale who recognize the need joined together to promote helping our people regain food security. It's the Riverdale Food Working Group, and we initiated community gardens where low-income people can grow their own vegetables and fruit. On our property or on rooftops, unused patches, balconies, flower pots. And Riverdale Food Working Group also has good food markets. Field to Table delivers fresh fruit and vegetable to our 3 locations. The food is sold at almost wholesale cost. Volunteers staff it and get a food chit in return. We hired 1 unemployed man to take charge, of course, and we used to pay a chef to serve samples of a meal made with the food that we had on sale, plus recipes. But the chef and other educational activities and outings to pick your own had to stop, as we didn't get the grant to pay for our extras. So perhaps the government could find a fund for such healthy initiative in next year's budgets. Oh, and all 4 agencies have community kitchens. Our motto is delicious, nutritious, affordable food in community. Our Mustard Seed weekly community kitchen costs members $10 a month. They all participate, feel ownership, a sense of belonging, and dignity. The federal government could well make this motto its own, not copyright. Delicious, nutritious, affordable food in community. And we get wonderful newsletters from our members of Parliament, and maybe you could encourage all the members of Parliament, so I'm sure we're not alone in our view of having people being able to help themselves overcome poverty and food insecurity. And you could encourage them to look up people in their neighborhoods and give a little publicity there in your great newsletters. And thanks for asking.
OHIP covers health care for every part of our body except our teeth and gums. A recent study by Public Health Ontario found that 1 in every 5 Ontarians does not visit a dentist because they cannot afford it. Thousands of people in Ontario suffer from pain and infection from poor oral health. Many have no choice but to go to an emergency room of a hospital where they can get painkillers, but no dental treatment for the problem. In 2012, according to the Ministry of Health and Long-Term Care, there were almost 58,000 visits to Ontario hospital emergency rooms for dental problems. Did you know that every 9 minutes someone visits an Ontario emergency room with dental problems? And every 3 minutes someone visits a doctor's office with dental problems. These visits cost the province millions of dollars, and that often does not address the root of the dental problem. In 2012, a mobile dental clinic was launched with funding from Ministry of Health and the Ministry of Community and Social Services. It provides emergency dental care to homeless people living in shelters and attending drop-ins in Toronto. And I would like to read you a story about a client who attended the health bus and their experience. Today is a wonderful day. The dentist fixed my front tooth that has been broken for years. I have not smiled in years because of my teeth. I really appreciate this service. I have changed my life in this last hour. I already feel confident. Thank you so much. I'm smiling all the way home. You are the best ever. I can't say thank you enough. Today is the best day of my life. Thank you. I owe you a million. That's just one of the many letters that we have received. In 2006, as part of Ontario's poverty reduction strategy, the provincial government made a commitment to invest $45 million annually to provide dental care to low-income Ontarians. This was an important step forward, but adults were not included when the program was designed and implemented. The funding was allocated to start the Healthy Smiles program, which focused on low-income children under 18 years of age. It's called SINOT, Children in Need of Treatment. This program is delivered through a variety of models, and a number of community health centers are offering the program, but they did not receive operating funding. Some are experiencing shortfalls, and 2 community health center dental clinics have had to close. And in 2014, the Ontario government committed to extend dental programs to low-income adults by 2025. If the government would begin to show how this program will be implemented and when, it would be very helpful. Lack of oral health care is an urgent situation where people in pain cannot wait for 9 years for treatment. If the overall federal poverty reduction strategy included dental care, it would assist the Ontario government to provide much-needed dental services for low-income Ontarians. Maybe the province could begin with a pilot program, which redirects to community-based public dental programs the $30 or more million that is currently being spent on dental problems in Ontario's hospital emergency departments. In closing, I say thank you for this opportunity to speak to you about a health concern I feel very passionate about.
While Mary Macred and I were at the refugee center, our challenge at that time was not finding apartments for the people. It was finding furniture. And at that point, it was really important. They were refugees, they were out of the country, and moving into an empty apartment was not moving into a home. And so I began collecting furniture from the estate sale companies. And this is where we have an advantage as charities, not-for-profits. People come to our assistance, more so maybe than the government. When the refugee center closed, I recalled visiting a young Somalian mother who I was asked sick of health. Could I get her some furnishings? In the kitchen were 2 small pots, a scattering of forks and knives, 3 plates. And I wondered how this woman is feeding her family with so little. And I knew that she wasn't alone on the 14th floor of a high-rise in Scarborough. And I said to myself, this should not be happening here in our city and in our country. And the idea for Furniture Bank was born. Furniture Bank was incorporated federally in January 1998, and for the first 3 years operated on $3,000 startup grant from the city, period. People were wanting and willing to help. And the idea was that we collect furniture from people who are upgrading or downsizing, and we give it free of charge to those leaving streets, city shelters. Today, we are operating out of a 30,000 square foot warehouse. And last year, our fleet of 10 trucks picked up furniture from 7,471 donors whom we charge for the pickup. And from the warehouse, we distribute it without charge, except for the delivery charge, to 3,993 apartments for over 1,200 parents, adults, and children. All referred to us by 93 social service agencies. Now that sounds like a success story, but not for the other 170 social agencies who beg us weekly, please, we need your help. We want to be able to refer our families to you. I've learned from the clients themselves the significance of furniture, this hidden poverty. Sherry and her 4-year-old daughter had fled an abusive situation. In her empty apartment, she was living in fear that her child would be taken from her if a social worker happened to drop by and see that she couldn't provide the bare essentials for her. Her appointment at Furniture Bank freed her from that fear and gave her hope for a brighter future. You've heard a lot from a number of not-for-profit charitable organizations, and we daily meet those struggling to rise out of poverty. I urge you to follow these not-for-profit organizations. Rejoice in the importance of your funding to them, and assist as best you can to enable all of us together to lift our neighbors out of the prison of poverty, a prison both physical and psychological.